Hello, my name is Muhammad Ibrahim and I'm lecturer at the University of Hargeisa. In this section we will discuss fetal biometry. Fetal biometry is the sonographic measurement of fetal structures. There are three primary objectives for measuring fetal parts. Number one, to assign fetal gestational age, which is important to obstetrician because it affects the clinical management, like scheduling of invasive procedures such as chorionic villus sampling and genetic amniocentesis. Also, knowing gestational age allows obstetrician to anticipate normal spontaneous delivery or to plan elective delivery within the time frame of a term pregnancy. Number two, to diagnose fetal growth disorders by assessing if measured fetal parts are appropriate size for gestational age or by estimating fetal weight. For example, fetal weight of 2000 grams is normal for a fetus of 33 weeks, but will indicate growth restriction for a fetus of 36 weeks. Number three, to determine the appropriateness of the dimension of fetal structures against each other, or it's called ratio, and or against gestational age. Guidelines of American Institute of Ultrasound in Medicine for performance of antepartum obstetric ultrasound examination states assessment of gestational age should be accomplished at the time of the initial scan using a combination of cranial measurement such as biparietal diameter or head circumference and limb measurement such as femur length. In first trimester, we use mean sac diameter and crown rump length to estimate gestational age. In the absence of a detectable embryo, gestational age might be determined by measuring mean diameter of the gestational sac, known as mean sac diameter. Mean sac diameter is measured using the sum of three orthogonal dimensions of the fluid divided by 3. Longitudinally, two dimensions are measured, length and depth, and width is measured on transversely oriented image. The chorionic wall of the sac is not included in the measurement. Gestational sac measurement is accurate within approximately 1 week. Mean sac diameter increase about 1 mm per day in early gestation. Gestational age in days can be calculated by adding 30 to mean sac diameter in millimeters. For example, if mean sac diameter is 22 millimeters, then gestational age equals 22 plus 30, which is equals 52 days or 7 weeks and 3 days. This technique is accurate up to mean sac diameter of 25 millimeters. The mean sac diameter becomes progressively less reliable for predicting gestational age as the first trimester of pregnancy advances. Once the embryo can be seen, the measurement of choice for estimation of gestational age becomes crown rump length. Crown rump length is the maximal straight line length of the embryo or fetus from the top of the head to the bottom of the rump. Crown rump length measurement should never include the yolk sac and or extremities. Before 7.5 weeks, the embryo appears as a cluster of echoes near the yolk sac, and it's not generally possible to distinguish crown and rump. At 7.5 or actually 8 weeks, crown rump length is about 15 millimeters. It is generally possible to distinguish the crown and rump ends of the fetus or embryo. After 12 weeks, obtaining of good crown rump length measurement is generally more difficult due to increased fetal body movement. So the crown rump length should be made from an image in which the fetus appears to be in a slightly flexed or relaxed position. The sonographic estimate of gestational age will be within 0.5 weeks of the actual age in 95% of the cases. Accuracy decreases slightly within the increase in gestational age. The reason for excellent correlation between crown rump length and gestational age in early pregnancy is due to rapid growth of the embryo or fetus, minimal variation between fetuses of the same age, minimal variation between fetuses of different sex or race, and minimal effect by pathological disorders. This is an embryo at 6.5 weeks. It's difficult to differentiate between the crown and rump. This is another embryo at 7.5 weeks. This is the head. These are limb pads. Here is the torso. Calibers are placed at the top of the head and at the bottom of the torso. At 8.3 weeks, the embryo has a C-shaped configuration. The cephalad becomes prominent and contains an easily visible sonolucent structure. It is the developing rhomboencephalon. The rump might reveal a tail-like appendage. By 10 weeks, crown rump length is 30 millimeters. Head is disproportionately large relative to body. The limbs are well visualized and the gut is herniated into the base of the umbilical cord. In the second and third trimester, the fetus has grown sufficiently in size, so many structures can be identified and measured during this time. The basic fetal measurements used to estimate gestational age are biparietal diameter, head circumference, femur length, and abdominal circumference. Biparietal diameter is the most widely accepted means for measuring fetal head in the second trimester for estimating gestational age. It is important to determine the landmarks accurately. Fetal head should be in transverse axial section at the level of the thalamus and cavum septum lucidum and third ventricle. The calvaria should be smooth and symmetric bilaterally. Cursor is placed at the outer edge of the near calvarium and the inner edge of the far calvarium. This is transverse axial plane. Head is ovoid, not round. If it is round or brachycephaly, it can lead to overestimation of gestational age. This is the thalamus, appears as hypoechoic, heart-shaped in the central region of the brain. The linear midline echo between the thalami represents the third ventricle, not the falx cerebri. This is the falx cerebri, appears as a short midline echo anteriorly and posteriorly. This is the cavum septum lucidum, appears like anechoic box between the two frontal horns of the lateral ventricles. The cursors are positioned here at the outer edge of the near calvarial wall and here at the inner edge of the far calvarial wall. Look at this image. Is this the cavum septum lucidum? No. This is columns of Woodnecks, many times mistakenly identified as the cavum septum lucidum. The paired nerve of column of Woodnecks are located just inferior to the cavum septum lucidum. The hyperechoic line represents reflections from the medial walls of the lateral ventricles, whereas the central echogenic line likely represents interface between the columns of Woodnecks. But the columns of Woodnecks and thalami are still accurate level for the PPD and hair circumference measurement. All reports on the PPD have demonstrated it to be an accurate predictor for ministerial age before 20 weeks. For example, Hadlock demonstrated the variability to be plus or minus 1 week or 2 standard deviation in a population of 1,771 patients seen between 14 to 20 weeks. After 26 weeks, correlation of biparietal diameter with the gestational age decreased because of the biological variability. The predictive value decreased to plus or minus 3 weeks in third trimester. The head circumference measurement is taken in transverse plane at the level of the PPD and can be calculated from the same frozen image. The head circumference can be measured with electronic tracing elliptical calibers that allows head circumference to be calculated electronically, or it might be calculated by obtaining the appropriate transverse and occipitofrontal diameters and by using this formula. Head circumference equals outer to outer biparietal diameter plus outer to outer occipitofrontal diameter multiplied by 1.57, which is a mathematical constant. This is the plane of section that fulfills the criteria for measuring biparietal diameter and head circumference. This is the thalamus, this is the third ventricle, and this is the cavum septum lucidum. Ellipse is carefully fit to the calvarial margins, so correctly assumed 17.9 centimeters is highly accurate. Head circumference is one of the most reliable individual parameters for estimation of ministerial age. This is due to its shape independence. In a study published in 1982, a series of 594 patients demonstrated that the hair circumference was superior to the biparietal diameter as a predictor of gestational age. Cephalic index, also known as the transverse head diameter to occipitofrontal diameter ratio. The normal range for cephalic index is independent of gestational age, and it is 0.70 to 0.86. When the cephalic index falls within the normal range, the biparietal diameter remains acceptable parameter to estimate fetal age. If the cephalic index is below 0.70, it indicates head shape with a narrow biparietal diameter in proportion to the occipitofrontal diameter. This is known as dolichocephaly. With dolichocephaly, the biparietal diameter underestimates gestational age. The most common cause of dolichocephaly is oligohydramnios. Other causes might be multiple pregnancy, breech position, and prim gravida. If the cephalic index value is above 0.86, it indicates a fetal head which is rounder than the normal and is known as a brachycephaly. With brachycephaly, the biparietal diameter overestimates gestational age. Brachycephaly is much less common than the dolichocephaly. It is reported to be most commonly associated with multiple pregnancies. The femur length image is generally the easiest of the standard fetal biometric images to perform. The femur echo can be identified by using iliac bone as a reference point and rotating the transducer until the longest femur length is obtained. The calibers are positioned to measure the end-to-end of the diaphysis, excluding any ossified portion of the femoral neck, head, and distal or proximal epiphysis, which are visualized only in the third trimester. This is the longitudinal section of fetal femur. Longest section of the bone is obtained. Calibers are placed at the greater trochanter to the external condyle. Another ideal image for femur length measurement at 29 weeks. Longest section of femur is obtained. Cursor is placed at the end to the end of the diaphysis. The guidelines of American Institute of Ultrasound in Medicine proposed femur length as a standard measurement for determination of gestational age in the second and third trimester, because femur length is shape independent and usually measurable regardless of fetal posture. It's generally a better parameter than PPD and hair circumference in the third trimester. In abdominal circumference, the fetal abdomen should be measured in a transverse plane at the level of the liver, where the umbilical vein branches into the left portal sinus. In this plane, the left portal vein and right portal vein form a J shape. The stomach bubble is seen at this level on the left side of the fetal abdomen. Fetal kidneys should not be seen in the proper abdominal circumference image. The calibers should be placed at the outer edge of the fetal abdomen and can be measured with the same instrument used to measure hair circumference. This is an illustration of correct level for abdominal circumference. This is the junction of the right and left portal vein. This is ductus venosus. This is the stomach, and this is the spine. In this image, this is the J shape of left and right portal veins. Here's the stomach, and here is the spine, giving distal shadowing. Another correct level for measuring abdominal circumference. This is the umbilical vein. Does not have to be visualized for its entire length, otherwise it's an oblique section. Here is the adrenal glands. In older fetus, it's normal to be seen at the level of the abdominal circumference. Abdominal circumference is generally considered the least accurate of the standard fetal biometric measurement, and this is possibly due to greater difficulty in obtaining an ideal image. The greatest value of abdominal circumference is not in the estimation of fetal age, but in the estimation of fetal weight and diagnosis of fetal growth disorders. Abdominal circumference should not be used for estimation of gestational age when there is evidence of significant abdominal pathology affecting the abdominal circumference, such as ascites, hepatomegaly, AIUM, and macrosomia. Other fetal measurements. Many nomograms have been published correlating various fetal structures with gestational age, including binocular diameter, foot length, and transverse cerebellar diameter. The main usefulness of these measurements is not to predict gestational age, but to determine whether a structure is of appropriate size or dimensions for a known or sonographically predicted gestational age. Once parameters have been measured, an estimate of fetal weight can be measured. Many researchers have published fetal weight formulas and tables derived from single and multiple fetal parameters to generate estimates of fetal weight. Shepherds and Hadlocks are the most common. Shepherds used two parameters, PPD and abdominal circumference, and estimated fetal weight within 10% of the actual weight in 85% of cases. The Hadlock formula improves upon this by using three parameters and reduced the random error by 15 to 25% less than when using only two parameters. Most modern ultrasound equipment come with a computer package that will automatically calculate estimated fetal weight. The accuracy of estimated fetal weight improves when three parameters are used in the weight formula. The best combination of standard fetal parameters are the head circumference, abdominal circumference, and femur length, with an accuracy of about plus or minus 15%. In this fetus, three parameters are used: PPD, femur length, and abdominal circumference. Then automatically the machine will calculate the fetal weight. Finally, I would like to attract your attention to some important points regarding fetal biometry. The accuracy of estimating fetal age in the second and third trimester decreases as pregnancy progresses, and this is due to increasing biological variation. So gestational age estimates done early in the second trimester are more accurate than measurements done later in the second and third trimester. So in general, the accuracy of gestational age prediction in the second trimester is approximately plus or minus 7 days before 20 weeks and plus or minus 10 days after 20 weeks. The accuracy of fetal age prediction in the third trimester is about plus or minus 21 days. Therefore, gestational age should never be reassigned. For example, if a patient has two ultrasound studies 6 weeks apart, gestational age should be based on the first study. Thank you.